It has been said that when Humpty Dumpty had his great fall, that all the king's horses and all the king's men could not put Humpty together again. But this man, Dr. Brett Reuter, if you have your great fall, he is a man who can help put you back together again. Dr. Brett, thanks for taking some time and talking with me today.
Absolutely. Thanks for having me. I appreciate it.
Absolutely. Listen, let's jump right in here real quick. Tell us a little bit first about your office and what makes you guys special.
So here at Advanced Medical of Florida, we're a multi-specialty clinic. We offer medical pain management, physical therapy, and chiropractic services. So we work together as a team. A lot of people like that because we can collaborate very well with one another. We're also a certified DME supplier, so we can fit people for braces, such as knee braces. Or
We've got one of those, so this is not a knee brace, but this is a specialty neck brace.
That's right. So, and that's covered by insurance when we prescribe it. We also are bilingual practice, so we have a lot of Spanish speakers in the clinic, which is nice. And we offer extended hours, so a lot of people work past 5 p.m. so we see a lot of people after work. We're open 8:30 a.m. to 7 p.m. and then we also offer some Saturday availability by appointment, so those are mainly every other Saturday for injections. And we also do same day appointments, so if somebody's really hurting, they can just walk right in and we'll get them taken care of.
And so first of all, having physical therapists and chiropractors and the medical director, is that what it is?
Yeah.
All in one office? That's not something you would normally find in many places, right?
Correct, yeah. A lot of times you'll see just a physical therapy clinic with just physical therapy, or a medical office that just has medical doctor, physician assistant. But since we're all under one roof, a lot of patients they see maybe 2 doctors at once or 3 doctors all in the same visit, so it saves them a trip. They don't have to drive across town. It's much more efficient.
Absolutely. So this is like your one-stop shop for fixing things up and after they've been broken.
That's right.
But not always broken, but we're going to talk about that in a second. So I wanted to ask you said injections. So what are the injections that can be done?
Right, so we offer a wide variety of injections, anything from cortisone, trigger point injections. Our most popular one is Supartz injection, so it's a synthetic synovial fluid that actually helps add layers of protection to the cartilage. It's FDA approved and it's covered by Medicare, and all of our injections are done guided with either a fluoroscope or ultrasound, so that way it's not just going blind. We're very specific with everything we do.
Cool. And so synovial fluid, for if you don't know, and correct me if I'm wrong, but you can kind of imagine like all the different joints in your body. So imagine if the 2 points coming together had like a Ziploc bag around it and it would have like an oil inside. I mean, is that a real super basic kind of idea how it works?
Absolutely. Just like a car needs oil to lubricate its parts, that's kind of what synovial fluid is like. When you add motion, it helps.
So it lubricates all the movement that the bones do against each other.
Absolutely.
Cool. So let's talk about you specifically. Tell us a little bit about your journey. How did you come to be, a physical therapist and working here in the office?
Great. Yeah. So I was born and raised in Wisconsin. I went to school in Iowa, and I lived in Chicago for a while as a physical therapist practicing, and decided to move to Florida because of the beautiful weather, the beaches, and everything. So we opened the practices about 4 years ago, and it's haven't looked back since.
Awesome. So you said practices also. So you got more than one location, right?
Yep, we have a location in Seminole and in Clearwater. So specifically Gulf to Bay and Keene, and Park and Seminole Boulevard area.
And between the two, that covers a pretty good portion of Central and South Pinellas, I'd say.
Yeah, absolutely.
Yeah. So everybody come in and see them.
Thanks. Appreciate it.
So what kicked you off? What inspired you to become a physical therapist?
Honestly, neither one of my parents went to college, so just growing up with my parents struggling over the bills. My dad is a factory worker, and his dad was a factory worker, and I just remember, even the phones getting disconnected and just having some struggling times. So that really inspired me to get an education. I was the first person in my family to go to college, so that really impacted me, and just wanting to try to break that generational
Sure.
change. And that's for me personally, and for our clinics. Honestly, we love to make an impact. So anybody who is in pain, we just want to improve their quality of life and get their lives back.
Yeah, if I'm not mistaken, you've got a tagline for your business, which is something like getting you out of pain as fast as possible. What is it?
Yeah, we specialize in getting people out of pain as quickly as possible. Yes.
Yeah. And so on a side note, and not to make it too biased, but so about a year and a half ago, I got a bulging disc while doing something crazy at work, even though it wasn't that crazy, but still. But I came to Dr. Brett here and his office, and they helped me out. I think I was coming once, maybe twice a week for 6 weeks or something like that. But yeah, they do great work. They got me, back where I needed to be. So I appreciate that for sure.
Thank you. Yeah, it was great having you. I'm glad you're feeling better.
Yeah. And so, what is the typical patient for your clinic look like? Who normally comes here?
Yeah, so usually, living in Florida, it's not uncommon to see people between the ages of like 45 and 75 years old, different types of joint pain, knee pain, back pain, things of that nature.
Sure. And so that's kind of like a general wear and tear body for a lot of people?
Yeah, sometimes, these people, weekend warriors or of that nature where they're doing something a little atypical and they get injured. Other times it's just, an office worker or something like that has aches and pains.
Yeah. And so that's not the only people that can come, I believe, because you're a certified strength and conditioning specialist, right? So that means you can actually work with athletes and stuff a lot better than maybe somebody else.
That's exactly right. So with the additional credential, basically that allows us to see athletes. So we've seen people from like gymnasts at USF or a Bucks player, or a lot of times teenagers come in with different injuries. So yeah, we can see all ages, which is great for the general population to know.
And that could be something really interesting for everybody out here to know too, because there's probably some general myths and misconceptions people might have about, coming to a clinic like this. Is that right?
Yes. A lot of people think that they have to be injured to come in, which we actually do a lot of injury prevention, teaching ergonomics and body mechanics on proper ways to lift, and just strengthening so that way people are able to stay ahead of it and prevent injury. Also, a lot of people think that as physical therapists, we are massage therapists where we just do massage and they want the feel-good stuff, or we are physical therapists in a sense where we're more like personal trainers, where all we do is exercise the whole time, and sometimes that would make somebody worse if they're in a lot of pain. They don't want to exercise or do squats or something if they have knee pain. Well, I wanted to bust that myth and say if somebody's in pain, well, we're not going to be putting anybody through painful exercises. We actually really work on people come to our clinic to get pain relief. So we take a completely different approach for somebody who's in pain versus somebody who's not in pain.
Sure. Mm-hmm. And as an active guy myself, I run into people often tell me, "You're not going to be able to do that when you get older." And I say, "That's because you've been beating yourself up for 70 years. That's why." So stay active. Come see people like Dr. Brett and his team here, or maybe not team, but the cohorts, the rest of the clinicians here in the office, and you guys can keep us on the right path,
Absolutely, yeah. We even had one guy not too long ago, a 92-year-old with a torn rotator cuff. He's still playing 18 holes of golf every day, so you can stay active your whole life.
Dude, absolutely. So is there any like special inspiring quotes or anything that you either use to kind of, as not the guide for your life, but something that you like to guide your life or you like to pass on to others? Or do you have any specific quotes that you yourself kind of pass out to everybody as wisdom?
Yeah, I like a Zig Ziglar quote: "When life is an uphill struggle, just think of the view from the top." That allows you to push forward.
That's pretty good. Zig's got some good stuff out there. If you haven't checked him out, you can. In fact, there's one that he says that I like also, which is, when a person helps other people get what they want enough, they in turn will eventually get what I originally wanted. Me? Is it me? I don't know. It could be me. Maybe it's him. So what's the best places for people to find you guys, both online and physically?
I would say www.amfhealthcare.com is our website. That's a great place. Otherwise, calling in 727-408-5222 is another great method. Just calling in. You'll always speak with a live person right away, which is great. Otherwise, if you just simply type in Advanced Medical of Florida into Google, you'll find us right away. We'll pop right up.
Cool. And so, as far as the clinic goes, about how many people do you have staffed?
Right now, we have 17 people staffed. However, the number does fluctuate because what happens is we've been hiring and growing pretty rapidly, so it's hard to always keep an accurate total, but that's where we're at right now.
Cool.
Great.
Excellent. So plenty of help for everybody that needs to come in. So don't worry about it. Call them up, make the appointment, get in here and see them. So with that part being said, is there any kind of special, do you guys do specials or anything like that for?
Yeah, I think for anybody watching this video, we'll offer a free consultation. So all you need to do is just call in. The phone number, once again, 727-408-5222. And what will happen is you just call in and just say, I would like a no-charge consultation. And they'll set you up with one of our doctors and at least get it complimentary checked out, see if you're a candidate for one of our programs or if you need to be seen somewhere else just to get you guys help.
It never hurts to ask, but if you don't ask, you might continue to hurt. I just came up with that. Wasn't that great?
Yeah.
Brett, is there anything that we haven't covered that you feel is important that you want to talk about before we say goodbye?
No, that's it. Just anybody who has an ache or a pain, and if you're questioning whether you should get it looked at, just call in for a no-charge consultation today.
That's great. So to wrap everything up, make sure that you like and subscribe and hit notifications if you're watching this on YouTube. Share it with all your friends and your family. Definitely follow Dr. Brett in the clinic here at AMFHealthcare.com. Did I get that right?
That's correct.
All right, so get on their website and then connect with all their social media so you always know what they're doing. And get in here and get better.
Great. Thank you.
Thank you, sir. I appreciate it.
Appreciate it.